guys, I just wanted to do a quick video to show you kind of the blood tubing that you'll be using during our simulation, and tubing that you could be using when you are a nurse, and then also how to prime the blood tubing so you're ready for our simulation. So there's lots of different kinds of blood tubing. You can have just regular old standard blood tubing, meaning it doesn't go in the pump. Okay. You can have pump tubing. So this is the Alaris pump tubing. So it's meant to go into your pump. Okay. And then this one is an older type of blood tubing, but it's out of the package. So I'll show you kind of all the components of blood tubing. Okay. So you have blood tubing always has 2 spikes, so that's how you know that you have blood tubing and not just regular IV tubing. Okay, the spikes all have caps on them. They also, all the spikes tubing has a roller clamp each. All blood tubing also has a filter, so this is what the filter looks like. So this is to help prevent any like little tiny blood clots from going into the patient. So it has the filter. This is also where your drip chamber is at. So if you're looking to see if your tubing is set up correctly and your blood is flowing in, you're going to look here for your drips. Okay. This one also has an extra little chamber on it. Not a lot of tubing has this, but you'll still see some that do have this extra chamber. This is really not for, it's not a filter, it's just kind of a little holding container for the blood just to go through. So, but it doesn't, if you don't have this little extra chamber, it doesn't hurt the tubing. If you have it, it also doesn't hurt. Okay, so it's just an older design. And then you have your lower tubing that's going to hook to your patient. And then this one also has a roller clamp. Okay. To prime the tubing, so I'll use this one because this is the one you're going to most likely see for the pump tubing, the Alaris pump tubing. So regardless of what tubing that you have or that you pick, most generally you guys are always going to be working with the pump tubing in the hospital setting, but if you're working outside the hospital setting, they may not have a pump. And that's okay. You can still hang blood via gravity just doing drips, okay? So then this would be the tubing that you would pick. But regardless of what kind you pick, they all have the instructions on them on how to prime the tubing, okay? So you just, if you haven't done it for a while, if you've forgotten, some areas you're going to, wherever you work, you're going to be doing blood transfusions pretty often. And then depending, again, on where you work, you may not be doing them as much. So if you ever forget how to prime the blood tubing, the instructions are always listed. Okay. They always give you the drops per ml on your non-pump tubing. Okay. So if you need to do your drip factor, you have the drops per ml. Okay. All right. So let's open our package. Okay, and so this is what your pump tubing looks like when you get it out of the, or the blood tubing, what it looks like when you get it out of the package. It's going to have this piece of paper that's holding it all together, so you can take that off. And then if you unwind all of this, again, you have those 2 spikes. And I always like to clamp my roller clamps when I take it out of the package. Okay, you have your filter. And then you have rest of your IV tubing line that's going to hook to your patient. You have another roller clamp, so just make sure that you close that one as well. Okay, And now you are ready to prime your tubing. Okay. Okay, so when you're ready to prime your tubing, you have your blood tubing, and then you also have the 500 ml bag of normal saline. You always prime your blood tubing with normal saline first, okay? And 500 ml or less is a sufficient amount to prime all of this tubing. The priming fluid volume on this one is 30 cc's. So this will obviously be enough to prime all of your tubing. Okay, so you can use either spike, it doesn't matter. There just are two spikes, obviously, because you need one to prime with saline and the other one is for your blood. So you can use whatever spike you want. So I'm going to open my normal saline. All my clamps are clamped, and I'm going to take one of the caps off of my normal saline lid, and then I'm going to spike my normal saline. Okay, you're spiked. We're going to hang it up. Okay, the first thing that we want to do is make sure this line and our filter chamber is primed and filled with fluid. So we want to open up the roller clamp that's attached to our saline. Okay, that's going to get the fluid going. And then to get the fluid into the filter, you need to squeeze your filter. Okay, on this one, this is your filter right here, so you want the saline to be just a little bit above your filter, and that's the same as it is on all of the blood tubing. You always want the saline to be just above that filter, so the blood's not hitting the filter directly. It has a little bit of cushion, and it's hitting the normal saline first. Okay, if you can see that, here's our filter, and then the saline is just a little bit above that, and that's perfect because I can still see my drips. Okay. Next, we want to prime this tail. So this is the tail that's going to be spiked into your blood. Okay, we want to prime that before we prime rest of this line. Okay, we want to make sure all the air is out from the upper end before we make sure all the air is out from the lower end. So all we have to do is open our roller clamp. Okay. And it's going to start just flowing through there. Make sure we get all of the air bubbles out. Okay, that looks really good. Okay, so now I know that I don't have any air in this line. This is the one that our blood's going to be hooked to. This one doesn't have any air, and our filter looks good. Okay, here's our filter. Our saline level is still at a good mark to where I can see my drips. And now I am ready to prime that lower level of my line. Okay, so I just open her up. Okay, and now all the rest of my tubing is primed. There's no air bubbles. It looks good. It's now ready to attach to my patient. So while you're waiting for your blood, you can just hang it over your IV pole. Okay. Notice all my caps are still on. If you need to loosen them, you can to get this to prime all the way to the end. But you don't have to take it all the way off. So then you can just twist it back on, and now everything is still sterile. The same with this one. I didn't really need to take it off to prime it. I just loosened it a little bit. And so I can just push it back on, and then that means that this tip is still sterile. So when I spike my blood, it's not going to be contaminated. Okay. And then you can just wait for your blood to arrive. And that's it. If you have any questions, just let me know. And have a nice day.